Welcome to this webinar for Careers Champions. I'm Margaret Holborough and this is my colleague Lisa Stone, and we're Senior Careers Advisors with Health Education England, working across Kent, Surrey and Sussex. I'd really like to welcome you this evening and thank you very much for giving up some of your time. We feel very strongly that our Careers Champions scheme is of enormous value to the trainees, and we thought it would be a good opportunity to run a webinar for you to help you maximise the opportunity to give the best possible support to the trainees that you're dealing with and who contact you via the scheme. Just a brief explanation as to why we've called it Careers Champions and not Specialty Champions. The two terminologies are completely interchangeable. You started life as Specialty Champions, and that's where the whole scheme was born, was with medical trainees. We do have a plan to roll out the scheme to some additional professional groups, so particularly maybe the dentists and the pharmacists. And because they don't have the same terminology that they do in medicine, we've changed the title to Careers Champions. But you're still very special to us and you're still our Specialty Champions. What we're hoping to do this evening is to give you some tips and hints and tools to use with the trainees. It is really enormously important and responsible, the role that you're taking on, and people will look to you for advice and information and guidance. So we want to share some of the guidance principles that we use as professional careers advisors and that we hope that you can take forward when dealing with the trainees that contact you. So we've got around about 45 minutes, and what we'll do is we'll show you some slides. We'll have a few polls, which gives you an opportunity to answer some questions that we pose to you. The whole session is going to be, or is being recorded, and at some point in the next few days we will be able to have a web link to the recording of the webinar, which will allow you to go back and revisit the session this evening, maybe look at the slides again or check out the polls again. And that will be available probably on both the STFS and the KSS websites. You'll see, some of you have used it already, that there is a chat box in the corner of the screen. We propose to take some questions at the end. We're hoping to finish with 10 or 15 minutes to spare, which would then give us an hour session. And you can type your questions into the chat box and we will attempt to answer them verbally. That's by far the quickest method. So we want to thank you for A, for joining us, and B, for volunteering to be our champions and participating in the session this evening. So we're going to take it in turns to go through the things that we want to say to you. So bear with us when we shuffle about and hand over mouses and mice and things between ourselves. So during the session this evening, we're going to cover what we call the four-stage model of career planning. And this is a really useful, logical, progressive technique and tool that we use all the time with the trainees that we see. And I think you'll find it a very useful method to use yourselves when dealing with the trainees that you speak to. We're going to look at how possible it is to build rapport with people just using an online environment when you don't have a face-to-face conversation and you don't have an opportunity for a telephone. And whilst some of the work that you do as champions will be telephone and face-to-face, it's probable that a fair amount more will be done online. So giving you some techniques for dealing with people who are contacting you via email, we feel is quite important. We're going to look at some of the questions that the trainees might ask you, and they will have asked you already, and some strategies for dealing with them and responding appropriately. It's very important when you are giving advice and guidance to people that you manage their expectations, that you don't overpromise, that you don't say, well, you know, I can help you with this and help you with that, when effectively that's not something that you can do. And it's worth having boundaries set when you're engaging in a career support conversation so that everybody knows what you can do and what you can't do, and what they can do and what they can't do. And then finally, we're going to look at some of the do's and don'ts of giving careers advice, that some of them are just common sense and some of them are grounded in careers guidance theory, which we hope to share with you this evening. So I'm going to start off by looking at something that you should be enormously familiar with, and that is the framework of a patient consultation. And very handily, we feel that there are 4 stages to the framework of a patient consultation that you might follow. So you'd start by talking to your patient, you'd look at their history, you'd find out what's happened with them to bring them to the point that they are now, which is in front of you with some sort of medical problem. And you'd look at maybe their social background and their history of all their medical illnesses. And then you'd go to stage 2, which would be to examine them and maybe ordering some further tests if you felt that they were necessary. Following that, you'd go to a stage 3, which would be to formulate a diagnosis, and that would be then inform the next stage, which would be to implement a treatment plan. So this is a logical and progressive framework that you would use all the time, and I'm sure you do it without even thinking about it. And for us, it's really convenient because it matches the 4-stage career planning model that I said we were going to cover. The first stage of which is the self-assessment stage. And we're going to look at the self-assessment stage and the second stage, the career exploration, in a little bit more detail, because these are the 2 most important elements that get people started on a career decision-making process. So to match your patient consultation, we've got the self-assessment stage, which is looking at people's background and their interests, and a few more things that we'll talk about in a moment. Then considering what the possible options are in terms of career moves, the career exploration stage, making sure that people know where and how they can find things out. The third stage would then be to make a decision. And that can be as challenging as the first 2 stages. You can have all the information that you need, you could have done all the self-assessment in the world, and you still can't make a decision. So the decision-making stage can be difficult, and it may well be that trainees will come to you at any of those first 3 stages to get some advice. And finally, to parallel the treatment plan for your patients, we have a plan implementation, which would be to put in place any necessary steps, be it a CV, an application form, some interview preparation, to enable the trainees to move to the next stage of training wherever they've decided to go. So a very familiar framework, a very familiar model, which we hope you'll find very easy to transfer across to dealing with trainees who are asking you for careers advice. So there are the 4 stages just listed out in order. The key things to remember with this model are that the first 2 stages are quite closely linked, the self-assessment stage and the career exploration stage. And it's possible to move backwards and forwards. The 2 things are not done exclusively and then somebody would move on. They can go backwards and forwards between those 2 stages. You can equally change your mind and make different decisions at different stages. And people's careers are not a straightforward destination. People's careers are a journey. They go from one step to the next to the next place to the next place. So it's encouraging decision making at whatever stage they happen to be. And again, you can interchange between the self-assessment and the looking at opportunities stage with the decision making stage. It encourages a logical and sensible progression. But the final aim, unlike with your patients maybe, is that we're not looking for a definitive diagnosis. We're looking for some information to help the trainee that you're dealing with to make an expert decision on themselves, for themselves, about where they feel it's appropriate to go. And your role is not necessarily to take the lead in that, but it's to share conversations about people's goals, to share discussions about the career planning framework, to give the trainee the opportunity to take the lead in the conversations, and for you to act more as a facilitator than a director. Any course of training for careers guidance emphasises time and time again that we're in a non-directive role, that we're not directing people into certain careers, certain jobs, certain roles. we're providing support for them to make their own decisions. So the facilitative role is a really important element to remember. So I'm going to hand over to Lisa to talk you through the stage 1 self-assessment.
Okay, so a little bit more detail about the self-assessment stage now, the first stage. So divided this into 4 different elements. So we've got values, so what would be important to the trainee. So examples of that are being in a challenging role. That's important to many people. Status, team working, autonomy. Basically everyone's different, so it's good to have a conversation with the trainee that you're talking to really ask what is important to them. And you might want to direct them to there's a really good website, the Health Careers website, that has some tools. It has a values tool that's aimed especially at medical trainees. And there's about 35 different values, and you can ask them to do that and have a look at it with them, and ask what their top 5 values are, what's really important to them. I think that's good in relation to thinking the second stage is exploring different roles. So if you were a psychiatrist, specialty champion, and you might want to talk about some of those things that are important to that particular trainee, where they would get them in your particular role. So values, I think that is key really to this self-assessment stage. And interests are very similar, so really that would be about what would get the trainee up in the morning, what they really enjoy doing. So some examples of that are, you may find some people love working with children. Others have come into medicine because they really like working with patients and helping patients. For some, it might be the science that they love. And it's quite interesting also too, if you do have time to ask them about what they like doing in their spare time as well. You'll get a feel of so how important the work-life balance is, and if they have other interests. There's also for some people they like to do different jobs. So having a portfolio career, that might be important to some people. So you can get the whole picture of the person and ask them lots of open questions about what they're like. And personality is another element of self-assessment. So that's really about the person's individual traits, their motivational drives, needs and attitudes. So examples there are introverted. You might get somebody that's more introverted compared to extroverted. So maybe that's about where they might get their energy from. Some people might really like being with a team of people and always want to have lots of people with them to bounce ideas off, whereas you may get somebody that's maybe more introverted that sometimes may want to also have the opportunity to work on their own. There's also varying degrees of how competitive they might be, their energy, their ambition, etc. And for this, you can direct them to, there are personality assessments online. If you think a trainee would benefit from a more deeper assessment, you can also get them to do something like the Myers-Briggs type indicator, which is fed back through usually an hour's feedback through somebody that's trained in giving specific feedback to the person. As careers advisors, we are trained in different personality assessments. Myers-Briggs is one of them. So that's one thing to consider in the self-assessment stage. And the last thing to consider would be also the skills and what the trainee is good at. So just thinking about things like maybe surgery or anaesthetics, practical procedures. I know there's other specialties where that's important too. Practical procedures might be particularly important, and it might be something they want to do because they feel that they really enjoy that aspect of their work. And teaching is another example, and communication skills. So I'm going to show you a nice quote now that's really about work values, and it was quoted by Nathan, who's an occupational psychologist. So he said that values in relation to work represent the degree to which a person regards his or her work as worthwhile. So he's coined this term worthwhileness, which it means that the amount of power, autonomy, creativity, learning, and altruism, security, status, and money which are sought in work. So some of those are some of the values that that might come up when you're actually talking to a trainee. So I think it's important to take those into consideration. So values fits very well with the stage 2 and career exploration. So really, it's related to the whole of those 4 elements of self-assessment. So I think it's good to bear that in mind. So as Margaret said, go through a logical process of going through self-assessment first, and then thinking, well, that person likes they like being autonomous, they like doing practical procedures, etc. You know, now let's explore what careers, what opportunities are out there for them. So there's because there's so many specialties in medicine, there's quite a lot they could do at this stage. And one of the things that we recommend is interviewing people that are in the role. So which is why we were very keen to set up the Careers Champion scheme in the first place. So talking to yourselves and encouraging the trainee to ask as many questions as they want about your role. That's an important strategy. There's also competition, which we call the C word, and labour market information, that's LMI. So that may not be the absolute most important thing in deciding a career, but it's something to bear in mind. And I think it's especially good to, if you clock that something is very competitive, and ask the trainee to look at that, and so that they're aware of it. So therefore, then they will need to go the extra mile and do a few extra things, perhaps to get their CV looking really good and their portfolio looking really good. So yeah, I think that's important. And the labour market information on the Health Careers website, because every single specialty has a section on labour market information and job information there. It's also at this stage, it's good to encourage people to have a plan B. So it's no bad thing if a trainee is considering or can't decide between 2 or 3 different specialties. Well, then they've got their plan B and also their plan C. So it's good to get them to bear in mind a few specialties at this stage. And they can later on go through a decision-making process to decide which one they really want to go for. You can use SMART goals as well at this stage, getting them to plan out what they want to do and how much time they want to spend looking and exploring all the different specialties and speaking to different people. And I would just say at this stage, be wary of spoon-feeding them too much. I think it's good to let the trainee do the legwork themselves, and you can facilitate putting them in contact. But then you've got the whole list of all the specialty champions, so you can point them to that list. But also maybe encouraging them to talk to more than one person in the specialty. You might be able to talk to some of your contacts as well, to let them know if there's a very specific area they want to go into. So at this stage, there are different ways of exploring the different careers that are available. So here are some other ways. Tasters, encouraging people to talk to people in the profession, like I've already said, and also encourage them to go to careers fairs, whether they're local careers fairs or national ones or Royal College ones. You can also signpost them to the person specifications. You'll be able to find those, they're on a specific website, but you'll be able to find them through the Health Careers website as well. And the Health Careers website itself is the UK authority it has the most detailed information on all the different specialties and lots of case studies and lots of information. So those are some of the things that you can do to help to aid the trainee in exploring all the careers that are available. So, right, going to move us on now to our first poll. I'm going to hand you over to Margaret. She's going to talk that through with you.
Okay, so I mentioned at the beginning that we've got 3 polls for you during the course of this webinar, and these are an opportunity for us to pose some questions for you to think about and then to answer on your screens. So the first question is about things that a trainee might ask you, and you've got a selection of different options here, 4 different questions to look at, and vote with your little buttons which of those you feel would be most daunting if a trainee were to ask you it.
And just answer one question.
Yes, just choose one answer. Thank you. I forgot to give you that instruction, just answer one. You should be able to see how everybody else is voting as well on the side there. Okay, that's 25 responses. I think, is there maybe one other person who's still thinking? Okay, we'll something changed then.
Yes,
26, right,
now.
Everybody has voted. Thank you very much for participating and for voting. By far, the most daunting question 18 of you have chosen is your field likely to change substantially in the next few years? Which begs the question, can we rustle up a few crystal balls for you to help you answer the question? It is, of course, an extraordinarily difficult question to answer, and with the climates, both medical and political and economic and all of those things, not to mention a little vote that we're all having next week, it is an extremely difficult question to answer. I think whenever you get a question that's difficult, it's really worth just being open and honest with your trainees. As a careers advisor, one of my worst experiences is to be asked a question that I don't know the answer to. And I consider it a personal challenge then to go off and find the answer. So we're not suggesting that you do that and you spend time then researching the answer for your trainee, but I think you can talk through why you can't predict how your specialty is going to change over the coming years, and just help them to see that in actual fact, because you haven't got a crystal ball and nobody has, it isn't possible. But what you can do is point them to resources or talk to them about trends that are going on at the moment. I know I had the opportunity to observe some ST3 interviews last year for medical oncology, and it was really remarkable how many of the trainees attending the interviews didn't really know what the current trends were within that field. They didn't know what research was being undertaken, they didn't know what developments were in the pipeline, and that would be information they could find out just from following resources that you might be able to direct them to. So the BMJ, the Royal Colleges, all of those things that you would just consider second nature to refer to, but a trainee may not, who's still at the early stages of training. So I think be open and honest about the questions that you can't answer, but guide people into how they can find the answers for themselves, if at all possible. The other questions which had fewer responses, every question's difficult if you don't know the answer. I think they say that on Who Wants to Be a Millionaire, one of the quiz shows. So in actual fact, don't be fazed if the question that's posed to you is one that you don't feel that you can answer. You might have strategies for referring somebody on to speak to somebody else, or you might have some sources that you can point them in the direction of. But I think just using some of the tips and techniques that we're talking about this evening, I think can help you to have an open conversation with the trainees who are asking you these questions. So we're going to go just back to our slides now. And I'm just going to talk briefly about how feasible it might be to establish a strong rapport with a trainee who's in contact with you. Now, if you have the opportunity for a face-to-face meeting or a telephone conversation, then there are lots of ways in which rapport can be built more easily because you have got that sort of more intimate contact with someone. But the difficult thing is to establish a strong rapport with somebody when all you have is an email contact and a series of email exchanges. So there are three things that we would like you just to bear in mind when you are developing rapport with the trainees who contact you. And those three things are to listen, acknowledge, and validate. So if time is short and you can't do anything else, focus on those three things and they will generate a strong rapport for you with your trainee. Looking at each one individually, listening is quite difficult if you're not using your ears, but in actual fact, when you are responding to a message, an email message, then you can demonstrate that you've listened to the question by answering the question. I don't know if you find it extremely irritating. I certainly do. If I've emailed somebody and asked them two questions and the response I get just answers one of them, and I then have to email them again and say, thank you very much, but could you answer the second question as well? So it's really important when you are dealing with an online message, an email or a text even, to read and understand the question that's been posed to you and to demonstrate that you've listened to it by providing a full, comprehensive answer to the question. It might be that you're really short of time, but in order to demonstrate that you have listened, I think it's worth just maybe waiting a little bit until you've got more time to answer the question before you do that. Because I think an open relationship online can be developed by you responding appropriately to the questions that you get asked. The second point is to acknowledge. Again, when you've got somebody in front of you or on the phone, there are lots of different ways that you can demonstrate that you understand who they are and where they're coming from. But when you're answering a response, answering by a written response, it's more difficult. But this technique of acknowledging is a way of developing rapport by showing that you've understood some qualities in the person who's been in touch with you. And it'll be from picking up phrases in their message or things that they've said that you pick up on. And you have to become quite hypersensitive to wording and ways of phrasing things, and even things like what time of the day or night have they been in touch with you. It's slightly more difficult with doctors because you do work nights, and therefore it might not be at all unusual to be sitting in front of a computer at 3 o'clock in the morning. But in certain circumstances, you might feel that the time of day that somebody has contacted you indicates that they're maybe not in the best place for personal reasons. So there's all sorts of things that you need to be a bit sort of second sense, sixth sense, if you like, to pick up on clues that something isn't quite well with the person who's in contact with you. And you can respond to people by showing that you recognise that they have an issue, or just that they're showing an enormous amount of enthusiasm or interest in the specialty that you're in yourself. So for an example at the bottom of the slide there is to show that you're sincere and genuine. You can say something like, it's obvious that you have huge amounts of passion and determination. Now, you can't just say that out of the blue if they haven't demonstrated that, but there will be things in their message that you can pick up on and then reflect back to them. And we've got a poll coming up shortly that will give you an opportunity to think about these things in a bit more detail. But acknowledging that you understand the person who's been in touch with you, I think, is a really important element of developing rapport. And then finally, the third thing would be to validate. And this is where you try to reassure the person who's been in touch with you that they haven't asked a silly question, they're not alone in how they're feeling, that you don't mind at all that they've asked you something that might be quite basic. And really just to give them freedom and leeway, if you like, to carry on contacting you in the same vein that they've contacted you already. When we do workshops with some of the trainees, we might want to encourage them to ask questions, and quite often, maybe because it's a face-to-face environment, they don't mind saying, this might be a silly question, but. Now, where they're in that sort of environment, and I think it's a more comfortable environment to be able to say, I think I should know this, but what's the answer to this question? With yourselves, you're being contacted by people who are more junior to you, who maybe don't want to come across as being ignorant or ill-informed or indecisive or anything like that. So I think you really need to validate by recognising that how they're feeling is absolutely fine, and that you're not judging them in any way. I did a careers interview recently, and the person kept apologising for what they were saying and saying, you know, don't judge me. And I had to say to her, as a careers advisor, I would never judge anybody about anything. So just to give people reassurance that their questions can't be silly, that you don't mind whatever they've asked you, and that they're not alone in feeling maybe ill-prepared or ill-informed about something that they're planning to do.
Yes, so this idea of not being judgmental segues really well into this slide, which is about unconditional positive regard. So it's a quote from a psychologist, a very famous psychologist called Carl Rogers. So he said that it is crucial that a mentor has this unconditional positive regard for the client. So you would be in that position as a specialty champion, not judging the trainee, trying to put yourself in the shoes of the trainee and trying to empathise with them. So it's all to do with building the rapport and encouraging them to talk as positively as possible with you. So you must be accepting of who they are and of the decisions that they have made. So that's something that's really important. So we're going to move on now to a poll. So this poll, just explain about it. So because it's a little bit complicated, this one.
We'd like to give you a challenge at this time of night.
Yes. So there's going to be 5 questions when we go to it, and it's thinking about. It's quite easy in the respect that you just answer yes or no to each of the questions, but there's a few of them. So it's so what you have to think about whether you can do this online or not. Okay, so we'll go to the poll now. So we're going to start in the left-hand top corner. So the question is always the same. So it's really thinking about how it might be more difficult to do something online as opposed to face. So so being 100% present and mindful is the first one, and so that's really about being, you know, if you are, it might be by email, if you are focused on answering the email and so there's no distractions, like as if you had somebody sat in front of you asking you something important. So I'll give you a bit of time to answer that question.
We're just going to show you the results as you're voting of each question one at a time. So don't be surprised because you probably can't see how people are voting on any of the other questions just yet, just that first one. Yeah, but we will show you as we go through. Yeah.
Okay, so there's a few more people to vote. We've got 27 participants now. I'll give you a bit more time. Yes, if you have voted on the first question, you could have a look at the other questions as well. But I would encourage everybody to vote on the first question. Give you a couple more minutes. Okay, so I think
there's a question there.
Oh right, there's a question. Does it count on the phone as well? Okay.
No, we really wanted you to focus on the online relationship that you have with the trainees. because with the phone and the face-to-face, it is much easier to do all of these things, a lot easier, but we're just mindful of the fact that a lot of you will be dealing with your trainees on an online, particularly. Yes, static online, I would say. Email really, or possibly text. You're probably less likely to use text. But no, not with Skype, because Skype you can actually interact with people as if you were in the room with them. So we're really just focusing on the straightforward email.
Should we just take that as a final result? I don't think anybody wrote it for a while.
That's fine. 25, yeah.
Yeah, so most people, well, about 2/3 of you think it's really hard, it's impossible to do online. So what you can do is some of the things that Margaret was talking about, being sure that you can answer all the questions and listen, acknowledge and validate, using the written word as much as you can. I mean, I think that's probably going to be the answer for a lot of these questions. I think, do you have anything else to add to that? That particular one, being present and mindful.
No, I think when you're dealing with an email query, then again it's the fullness and relevance of the response that you give them, and picking up on those things that we mentioned before, maybe how people are feeling, maybe there's some emotional usage of vocabulary in their email. So I think it's really just trying to be quite concentrated in terms of reading what they've sent you. I mean, not over analysing what's been said to you, but I think if somebody's, like I said before, if somebody's sent you a series of questions and you only answer 50% of them, then you're not demonstrating being 100% present and mindful. So it's really just the standard of the response that you send and showing that you've understood the question that you've been asked or the email that you've been sent.
Okay. Yeah.
And just to say to F1, we'll go through each one of these things and tell you what we mean by some of this terminology. Which
we're going to do that one next. Actually,
familiar.
The verbal mirroring. Shall we broadcast the results? Yeah. So you can see that it's about 50-50 on that one. So I'll explain verbal mirroring. So basically, when you face to face, if it's repeating the same words and phrases as the person that you're dealing with, and that is a way of sort of validating what they're saying. So if they're saying something to you and you're repeating it and you say yes, that's right, then that's what we would call verbal mirroring. So if you can do that online, I would argue that again it's being careful with the words that you use and repeating them. Maybe the person that's writing to you has said that, explained the situation, that they're very indecisive, say, and they think that's a trait of theirs. You could mirror that word by saying, so you feel that you're indecisive, do you? You know, what do you think that's about? That's an example of verbal mirroring. So yeah, I think we've got more positive than negative on that one, maybe since I've explained it. So we go on to the next one then. We'll go on to the one top right. We'll broadcast the results. We've got a resounding no really on that one. So tone of voice. So tone of voice is, so this is bearing in mind that when you're having a conversation, obviously you can undulate your voice. Online you can't really hear that. So it's, I think the trick to, so that is really hard, I agree, that's really hard to do online. I think the trick to that is, writing something, maybe imagining how somebody would read that, imagining the tone of voice somebody would read that message in. So that's could be, if you're saying something like, if they've asked you, one of those questions, say that the question that you didn't like was about, the worst question to be asked was about the future of your specialty. So maybe answering that question, being sure of the tone of voice, being maybe like I'm being hesitant now in what I say because I'm thinking it over, maybe sort of being a bit hesitant in the answer, saying, well, you could even go, well, ... That's something, it's very difficult to answer. I don't, there are a lot of changes in the technology and the specialty at the moment, and it's difficult to say, and then going some suggestions where they can research more. So
it sounds a bit weird to say it, but if you've typed a response, it's quite often worthwhile just reading it out loud. I mean, you know, people will think you've gone a bit nuts, but in actual fact, reading something out loud and then imagining if somebody was just reading it without hearing you say it out loud, is there a different way that they could interpret the tone? So you could say the question about, you know, is your specialty going to be changing in the future? You could be writing something about it's extremely difficult to be able to predict what's going to happen in the future, and that would be in a sort of sympathetic and empathetic way. But somebody reading it at the other end might read it as being, well, it's really difficult. It's really difficult to say, and that could come across as being a rather impatient response, as if to say, well, why have you asked me that? Because I obviously can't answer it. So I think you can get a bit oversensitive to these things, but I think we've all experienced situations where we've sent an email to someone and it has been misinterpreted, and they've read something into it that either you didn't mean or they've taken the wrong way. So you really just have to be quite careful. But a trick to getting the tone of voice across is to read it out loud yourself.
And I think this Dr. Omar has made a really good point, actually. It says, does tone rely on or is improved by knowing the person a little better? I think definitely it is, because otherwise it could be left to misinterpretation.
That's very true.
Yeah.
It's just one of the pitfalls of dealing with people online. But I think if you are aware of the fact that there is a pitfall and that it's worth just taking a bit of extra time, not just whizzing off the first response that you can think of, but maybe dwelling on it a little and maybe reading it twice or reading it out loud, it does hopefully help to avoid any misinterpretations.
And so we'll go to the fourth one. We'll broadcast the results. That's even bigger resounding no, because it's really difficult to do this online. So tuning into the emotion behind the words. So that could be about the person that's writing to you. You could find that difficult to interpret and tune into, or vice versa. And I think it is really, again, it is choosing those words really carefully. And if they are talking about, as often happens when you're talking about somebody's career, it's very personal to them. There can be a lot of emotion behind it, so it's just sort of bearing in mind that fact and being quite careful. I always read when I'm doing some careers guidance online, and we do get quite a lot of queries online that come in. It's like reading it over again and just making sure that the tone is right, similar to the tone of voice, really tuning into the emotion. So
I think I'd just say you can be mindful of little trigger words that might come up in somebody's email, that might indicate that they're feeling particularly stressed about a decision, or that they're coming under pressure, maybe from family or peers or friends or supervisors, you know, to go a certain way and they don't want to go a certain way. Or you might get little clues to the fact that somebody's even considering changing their career direction altogether. Again, I've said it before, you know, you can overanalyze these things, but I think you just need to be aware of the fact that somebody could be saying one thing in writing, but there are clues there to the fact that they actually feel something either more worrying or different from how it's coming across. It's a very difficult thing to do, but it's worth just taking a bit of extra time.
Yeah. And we'll publish the very last one now about reflecting back. And that's a resounding yes, which is good. Yeah, after all the no's, that's good, isn't it? So, I mean, I think that's, you can use summarising, I think, a lot. Just if you were having like an ongoing email conversation with them, just sometimes just pausing and summarising where you've got to, and using that sort of verbal mirroring and all those other things that we talked about, and listening, acknowledge, and validation as well in that particular aspect. So
I think encouraging people to come back to you as well, leave the door open so that if you have reflected back to them with some thoughts that might be helpful to them, to give them the opportunity to come back to you. Sometimes people are a bit reluctant, having had a response, to come back and ask you another question or get some more supplementary information. So as long as you feel that you can do that and that you can engage in maybe a longer exchange of emails with people, then it's quite nice just to be very open and say, well, do get back in touch if you'd like some more information.
Okay.
You probably do that anyway. It's probably built into your automatic email signature.
Okay, thanks for that. So we're going to go back to the presentation. Questions now, and there's a nice quote by Nancy Klein here. The mind works best in the presence of a question, especially when our goal is to promote good, independent thinking. So questions are important, and not going to spend too long on it, but just to go through. We're looking at closed questions versus open questions here, and so closed questions, just to explain, are questions where when you ask them, the answer is yes or no, or open ones are getting the person to really expand on what they think about something. So we've got a couple of examples there. So a nice open question is, tell me about what you expect from your team. So, and questions such as, asking what was happening about something, using the what, how, tell me about, those types of openers to questions are better and will get more of a in-depth answer from the person that you're talking to. This is either online or face-to-face. Whereas the closed question, would you like to be better at delegating? So yes or no. And that one is also quite leading, because it's got the would you like to be better, as if delegating is something that's really important. So it's quite a leading question, maybe directing the person to say yes to that. So that's another thing to think about. Just going to give you another example of leading versus reflective. So the leading one here is, you do realise that your excessive attention to detail is the reason you're not managing to get on top of things, don't you? So there's lots of things wrong with that question. So it's also very critical. So leading questions can sometimes come over as very critical. Whereas if you rephrase that question and made it more of a reflective, open question, it doesn't sound as critical, and you're just saying, you say you're finding it hard to get on top of your work. So that is, maybe they've actually said those words, so that is verbal mirroring again. And then just asking the question, what's happening? So that allows them to think about what they're saying and lets them be a bit more reflective. So you can see the difference between those types of questions. So, we've got another poll coming up. I'm just going to get that one up. Third and final poll, I'll let Margaret do it.
Okay, so this time we're going to give you a slightly different question. This is a scenario, so you have to read the scenario at the top and then a series of different responses, and you can choose as many of the answers as you feel are appropriate. So we'll give you a couple of minutes to read through the scenario, which is there. Tommy in the early stages of training, and he wants to switch to a very competitive specialty. From what he's telling you, he's lacking some skills, e.g. manual dexterity and academic skills that are essential for this area. So indicate all of the things below that apply, and you've got 5 different choices there. Okay, the numbers have stopped changing, so I think maybe you've had time to read through all of the options, and I'm absolutely delighted to tell you that you've all passed with flying colours and that nobody chose option 2, which is most definitely not something to do at all, and you've all been paying attention, so that's really good. The answer number 2 would be so directive and so unsupportive and non-facilitative that it's off the scale really. So any of the other 4 are absolutely fine for strategy. You can suggest any or all of those things, and each of them would provide a different opportunity for Tom to have a look at himself and the specialty and his suitability for the specialty. So you're absolutely right, and the majority of you, 26, voted for help your trainee to lay the groundwork by spending sufficient time on stages 1 and 2 of the 4-stage career planning model. I think our work here is done.
Yeah, we've got a question actually from
Emma again.
Yeah.
Okay, is 5.2 a directive? No, I think you could. Obviously, the way you phrased it would be very important, and I think rather than say ask him to seek advice from another doctor, I would phrase it as suggest that he might like to seek advice from another doctor, because I mean it's quite likely that it would be in your own specialty that you were talking to him about it, but it could be that there is another specialty that he has in mind that he would benefit from speaking to a champion or a doctor in that specialty as well. So no, it's just an additional way of gathering information, is to talk to other people within the same specialty or within a different specialty. So you would do it in a non-directive way, but I acknowledge the fact that we've phrased it in a slightly too directive way. But yeah, well, good point there. Good point. Smiley face. Excellent.
Good.
Right. Okay. So we're just back to our slides. We're on 50 minutes, so we're going quite well here. Okay, so just want to run through with you how the career support works for the South Thames Foundation School and KSS trainees in particular. So we work on what we call a 3-tier support system. We're at the bottom, so trainees within the trust, we would suggest speak to their education supervisor first. And it may be that would be as far as it needed to go, and that the ESs would provide as much support as the trainee needed. But it may be that the issues or the problems were more than the educational supervisor felt appropriate to deal with. In that case, they could be referred up to somebody else, so the DME or the TPD. Or a lot of trusts do have somebody who is designated as careers lead. So the 2 first levels of support would be within the trust, but then we would come in at the 3rd tier of the support pyramid, and there is an opportunity for you or anyone in your trust to refer people to the careers team for individual support. There tend to be categories of trainee that we see more frequently. The ones who are having maybe a problem with deciding which specialty to go for, or who maybe have chosen a specialty and are not progressing as well as they should do for careers reasons. We don't get involved in clinical reasons, but it may be that there's a clinical reason for their non-progression that's going to lead to them having to rethink their career plans. So there is a referral process that you can go through. We have got a careers inbox where referrals can be made, or Lisa and I will take referrals directly, and our email addresses are widely available. I'm not sure we've actually put them on these slides, but we're certainly available to be contacted via the websites. So that would be how the careers referrals would go. What we wanted to do now was just to run through some of the difficulties that you might encounter, and I think I'm handing back to Lisa, although she seems to be doing all the work this evening.
Okay, so so these are typical, in some cases not so common scenarios, but they are scenarios that are quite difficult to deal with. So if you've got a trainee with unrealistic career plans, so this could be the example like Tom, who perhaps didn't have the manual dexterity skills for the specialty he was going for. So how do you deal with them? As we've said, and as you all correctly answered, it's not being too directive. Perhaps thinking about a plan B with them and just posing them perhaps some challenging questions. Another example that I came across recently when I was doing a workshop with consultants said that they had somebody that was in this situation, and they were an A&E doctor, an A&E trainee who didn't like working with children. So maybe posing that sort of challenging question about thinking, if you are working in A&E, how many people, how many children do you think you will come across, and making sure that they are aware and making realistic career decisions based on what their job is actually like. And I think that's great. That's where the careers champions can really come in. But the question is, like, if the trainee still wants to pursue their dream, and maybe they're taking a little bit longer to go through the training, it goes along with not being too directive. If they still really want to pursue their dream, unless of course there's something stopping them, like they're not getting through their year, then the decision really is with them to keep going, as much as you can pose the challenging questions. And I think it's a balance really, because you don't want to knock somebody's confidence. Maybe some people don't learn at the same rate and pace as others, so it is really being a balance about being whether they are really unrealistic or they're just going to take a little bit longer than everyone else. But that is quite a difficult one to come across. The second one I want to talk about is a chronically indecisive trainee. So what we can do about that is the two first stages of the career planning model that we went through. Make sure they have not just skipped through to, am I choosing between psychiatry and GP? Make sure that they have gone through the thorough self-assessment and career exploration, and that they are self-aware to know that what they want to get out, what their work values are, and what they want to get out of the role. There are also some career decision-making exercises on the Health Careers website as well. The whole four-stage plan is in detail on there, so you can direct them to that, have a look at that yourself, and do be aware that they may want you to make a decision for them. So you may have come across somebody that says, "Oh, what do you think I should do?" And it's really not your role to make that decision, because they are the person that has to live with the decision. So I think it's important that they take responsibility for it. And then the trainee that's considering leaving medicine. So yeah, that is a tricky one, and it's really important to make sure that it's not just a trainee that's had a bad day, a bad week, and just really ask them a few questions about how things are going, and just find out what's going on with them. So if you do, after spending a bit of time talking to them, find that they are quite serious about leaving medicine, I mean, that could be one where you do refer the trainee to us using the referral system that Margaret has explained, and because we are aware of alternative careers where they could be using their transferable skills. I mean, after spending so long in medical school and training, often it's really difficult. They've invested so much time in medicine, and it often comes up in the early days of F1 that they just discover they chose this career when they were very young, and maybe it's not right for them. So it's not to be dismissive of their consideration, but it's really about helping them make a considered decision, because it's a very hard decision to make. So So I think that's those are the sort of main scenarios that are really difficult to deal with. I'm going to hand over to Margaret for the last slide. I
The
think.
last slide, yes, it's bang on 8 o'clock, and we have asked the two teams playing in the Euros not to score until we've finished. So apologies if you're dashing off to watch the football. We do have a question again about older trainees nearing CCT.
Yeah.
Don't apologise. I mean, we would give career support to anybody, regardless of what stage of training they were at, and whether they were thinking of leaving medicine or not.
And SAS doctors we've given careers advice to as well. It's not just trainees.
Post CCT, pushing your luck. We haven't been asked, I don't think, to give career support to consultants. So we'll have to park that one, because I'm not sure at this precise moment we don't really have the resources to go beyond supporting trainees who are still in training. But it's maybe an issue that we could take up at a later stage, maybe.
I mean, I think as long as it doesn't open whole floodgates, I think.
Yeah, the odd one.
Odd one, yeah. Because we're a very small team.
Yeah.
At the moment, it's just Margaret and me for the whole of KSS. But we're recruiting some new people. So.
Okay. So the final slide is just to look at some of the resources. We have referred to some of these already throughout the webinar, but just to put a little bit of meat on the bones, the Health Careers website has absorbed all of the previous information from the Medical Careers website, which has an enormous amount of information about the different roles within specialties, what people do in the different specialties, the different pathways, the training, the personality types, etc. They are really detailed and very well worth a look. The same website also has a section called I am ... and from the I am ... option, the heading along the top of the page, one of the choices is information for doctors, or working in the healthcare sector, and then information for doctors. So lots of information about being a foundation trainee, about specialty applications, all of that sort of stuff that you might get asked on, processes and procedures within specialty training, which is something that you might be familiar with, or you might feel a bit out of date on. So the Health Careers website's got an enormous amount of information. It's also got the 4-stage career planning model that we've talked about. And we are aware of the fact that we focused on stages 1 and 2, and we didn't really get a chance to talk about stages 3 and 4. There's another couple of webinars in those, I think. We just didn't have the time today, but we felt that the stages 1 and 2 were the most appropriate things to focus on with you this evening. The Foundation School website also has a careers guidance section, and there's information in there for foundation doctors themselves and people who advise them, including some workshop materials for doing specialty applications, information about the Specialty Champions and Careers Champions scheme, and some tools for people making career plans, so the MOT career planning tools. So there's lots of information in the careers guidance section on STFS, and similarly on the KSS website. There's a careers support section to that site, and that explains in more detail about what we do, the resources that we have, and what we can provide by way of support for consultants through our careers support workshops. So you'll find information in there as well. So those are the 3 key websites that we've mentioned this evening. In order to round off the webinar, before we go on for too long, I did mention at the beginning the whole thing has been recorded, with much trepidation on our part. So that recording will be available in a few days' time, and we'll circulate the link to the recording.
Maybe a copy of the slides as well. We could just send slides, because somebody's asked.
Oh, okay. Yeah. They will be in the webinar recording. If you actually wanted the PowerPoint, I'm sure we probably could do that. That would be okay. Just to say, we're also going to send you a survey monkey for some brief feedback on how you felt this webinar supported you and answered your needs. We'd be very grateful if you provide us with some feedback. In return, there's no bribery here, we will provide you with an attendance certificate for this evening. We're also in the process of just finalising a handbook for our careers champions, and that will have two sections to it, one for yourselves as the champions and one for the trainees who might wish to use the champion scheme. So it's sort of guidelines on what to expect and how it might be helpful. So the handbook will certainly come out to everybody who's on the database of specialty champions, career champions, as soon as it's finished. And we're looking just a couple of weeks here before you get this handbook. Wanted to thank you once again for volunteering to be champions in the first place, and then for coming along this evening and participating in the webinar in a very enthusiastic fashion. And there's lots of comments.
There's one particular question about how often are champions being contacted?
I don't know really. Not that frequently, I don't think. I think there was originally a suggestion that you'd be contacted on a quarterly basis.
Yeah, there's a newsletter actually. It went out today. That's our first newsletter, which goes out to all our medical education managers and careers leads and specialty champions. And we just have some topical things about, with some quotes about tasters on there and some case studies and things like that. So quarterly, I think.
Yeah, we are hoping to keep in touch with you more than we have in the past. And we do have an annual, we check up with you annually about whether you want to stay on the database or not. Do we do that annually?
Yeah, and of course we've got the Specialty Champs email address, so if you've got any questions or anything, you can get in contact with us directly.
So what is that, Specialty Champions?
I think it's Specialty Champs.
Specialty Champs at
kss.he.nhs.uk. Do trainees get in contact with us via?
No, what we suggest the trainees do is we point them in the direction of the STFS website, because there is now the Excel spreadsheet with all of your contact details on there. So you hopefully remember being asked if it was okay for us to publish, they're not published, to have your contact details on that spreadsheet. So the trainees can just log into the STFS website and find your details, and they will contact you directly. And apologies if you volunteered and nobody contacts you. That's a bit of a luck of the draw moment.
Oh, somebody hasn't been contacted for radiology. Yeah.
Okay.
Yeah, this is something that I think we're starting to put posters up in the, ask the trust to put posters up in the postgraduate centres. I think it's something you have to have several methods of getting, particularly with the foundation doctors, of getting through to them so that they know about it.
Yeah, there are quite a lot of people who have volunteered who have never been contacted, but please don't let that put you off, because one day there will be somebody who really wants to know something, and you'll be the person that they contact.
Yeah.
Yeah, I think that's a good point, Ahmed, and we are trying to publicise it all over the place. The weekly STFS bulletin, we do put information in there fairly frequently.
Yeah, we'll put something in soon, because we can just send it through.
Billy, no, mates. Don't take it personally. Please don't take it personally. Yeah. I think the scheme has more value if it looks as if there are a lot of people who are willing to participate. So the fact that there are lots of you is fantastic from our point of view. And we know that keeping you on board when you're not being contacted by trainees is maybe a bit tricky. And we would just urge you not to be at all discouraged. And we're doing our best to promote the scheme so that there will be more people. And we do get a lot of feedback from trainees about how difficult it is to make their specialty choices, because they have to do it so early, don't feel that they're informed enough on a whole range of different specialties that they've not tried. So we push the concept of the specialty champs really quite a lot.
Yeah, there's people are joining the specialty champs scheme all the time. There's a question about how many there are. There's about 450 altogether. Yeah. And they include South London as well as KSS, because we've sort of mapped it on the South Thames Foundation School Trust. So it's quite a widespread.
Yeah, we use the postgraduate education centres for the visual marketing material, which is a poster. We have it in all of our PowerPoint slides that we use in our workshops with the foundation trainees, and we have it in the STFS bulletin and on the website.
Do the Director of Postgraduate Medicine know about
They should do. They should do.
Maybe that's an idea to make sure. Maybe there's some trusts I noticed that haven't put the posters up, and we just want to make sure they are up everywhere so that people do see them.
And there's a question about are all the specialist champions consultants? No, not at all. There are people from ST1 upwards, actually, ST1, CT1 upwards. So when this was first envisaged, it was specifically for foundation trainees to get in touch with anybody who was higher than they were on the training ladder. So that was literally anybody from CT and ST1 upwards.
And I think sometimes I'm talking to somebody that's a near peer, so that they've just gone through the selection centre, or the choice that person is about to make is absolutely really helpful. So we do have, there's quite a few people that have said they're not consultants that are online now. So so that's good.
Full range.
Yeah.
Do you still do the careers fairs? I remember doing something at Stuart House. An hour or so with F1, F2 medical students. Yeah, the careers fair that you did at Stuart House was possibly arranged through the London Careers Unit. We work quite closely with them, but we focus on the KSS trusts particularly. And there are a number of different careers events that go on. It's probably fair to say that just at the moment, with all the internal changes going on within Health Education England, that we're still in the process of really working out how the collaboration is going to progress forwards. We're always looking for ways that we can collaborate, get more trainees involved. We do webinars with the foundation trainees as well, and we collaborate with the London Careers Unit for those. So South Thames Foundation School is completely covered by the two careers teams using the webinar processes. So we're doing our well. You do apologise for keeping you off from your dinners. Oh, good, right. Thank you, Samantha, for saying that you're willing to do to be advertised as LTFT. That's really helpful because we do get queries about LTFT.
Yeah. And we just put that onto the spreadsheet that you're radiology and have experience. I think less than full time.
Yeah, what we could do is if we could have a category for LTFT within the database.
Yeah, it's a good idea. It's coming out here. And there's somebody else as well. Yeah.
Okay,
brilliant.
Yeah. Okay.
Transferred out of surgery. So
oh my goodness, a specialty changer.
Yeah.
What resources and hidden talents you all have. Yes, we're always looking for people who can talk about changing specialties as well. We're just going to jot your name down, Samantha. You're not going to get away from us now. Okay, I think we'll probably. You're welcome. We'll probably call a halt there because it's almost 8:15, and whilst it's been really nice chatting to you all online, I'm sure you've got other things to do now. So thanks again for participating, and we'll look forward to meeting you with some of you face to face at some point.